Hi, so today we are going to be doing a masterclass about how to minimize the chances of having a C-section or a repeat C-section. So number one, planning a home birth. Home birth is really safe. A lot of people have fears surrounding home birth, but all births before used to take place at home. In fact, home birth, there has been many studies that have proven that home birth can be safer than a hospital birth because there's less medical interventions when it comes to home birth. Now, if you aren't able to have a home birth, maybe you don't have the support, or for some reason you're just not able to, then you can also think about getting a midwife in a hospital setting. There are some hospitals that have midwives, and there are some midwives who can support you in a hospital birth. Another thing that you can do is avoiding inductions. So having a spontaneous labor, so going into labor naturally on your own without the need of Pitocin or a Foley bulb or anything that jumpstarts labor can increase your chances of a more straightforward vaginal delivery. Knowing your Bishop score, which we're going to talk about soon, but knowing your Bishop score is also a way, sorry, I'm looking for something. Is also a way to prevent going into an induction type setting and your cervix not being prepared. Some people will schedule an induction and have a very low Bishop score, which we're going to talk about because you might be a little bit confused about it, but might have a very low Bishop score, and that increases their chances of having a C-section. Focusing on health and nutrition. This is really important as well, because then you're less likely to have things come up in your pregnancy, which can change the direction of your birth and make it lead towards a C-section. And if you're trying to have a VBAC, having a healthy pregnancy and everything going pretty straightforward can help everybody on your support team feel confident in you having a vaginal birth. Now, with nutrition, you want to have a balanced diet of whole foods. You want to, of course, go to the source, eating lots of fruits, lots of vegetables. We're not going to go in depth into health and nutrition in this class because that could be a whole master class on its own. But also breakfast, snack, lunch, snack, dinner, snack, and ensuring that you're meeting the requirements for your water intake. Practicing hypnobirthing or learning how to have a calm birth. Being able to feel confident in having a natural birth can help prevent a C-section because you're less likely to need medical pain medication to cope with labor. And a lot of the pain medications can increase the chances of having a C-section delivery. For example, Pitocin and the epidural are more likely to lead to having a C-section versus not using those two together. Water birth. Water birth is something that can also help you to minimize the chances of having a C-section. Water birth helps to take the edge off of your contractions, and that could be very beneficial in helping you to stay the course of your labor. Try to give birth as naturally as possible, so the least medical interventions. The more medical interventions are seen to be linked to repeat C-sections or having a C-section. Understanding the cascade of interventions, so the cascade of interventions is basically going into the hospital very, very early and not asking, but them wanting to do Pitocin right away. If you do Pitocin, the contractions are going to become more frequent. They're going to become longer and they're unnatural, so they'll feel more intense. So they're not like the normal contractions. They'll feel rapid. And a lot of women who have Pitocin contractions will then ask for the epidural. So now you've had Pitocin, now you get the epidural, but the epidural slows down the labor. But even though you're not feeling it because you have the epidural, the baby is still having these constant, frequent contractions. And because you have the epidural, you're now on the bed. So you're not able to move around and walk around and help your labor to progress, which can cause the baby to not be able to descend into the birth canal, which then leads to labor not progressing or needing instruments to help deliver the baby. So they might use a vacuum or forceps because baby's not descending to bring baby down. Or if baby's in distress from all the frequent contractions, then they might say that you might have to have an emergency C-section. So that's the cascade of interventions that you want to be aware of. Avoiding going to the hospital too early. So avoiding going to the hospital too early can help you prevent a repeat C-section and also having a C-section, because if you go super early, they're going to want things to progress. They're going to want to do things to you constantly. They come into the room very, very often to check on you, to see if there's any progression. And if you come in when you're in early labor, when things aren't going as quickly, you might be pressured to say yes to certain medications that you don't want to. Become knowledgeable and educate so you can spot misinformation. A lot of the times they might do a C-section for unnecessary reasons. So for example, in the US, 33% of births end in C-section and 17% of them are deemed unnecessary, meaning that they didn't have to have a C-section. So some of the times they will just come up with a reason, or there's a reason that they provide that isn't a necessary reason to have a C-section, and there's other things that you could do to solve the issue. And that can cause, if you aren't aware of what those things are and you can be misled, that can have you go into a C-section or a repeat C-section. So let's talk about the Bishop score. The Bishop score gives points to 5 measurements of the pelvic examination. So you are able to know your Bishop score when they check your cervix. When to ask for the Bishop score? If you are either having an induction or they're planning to give you an induction, ask if you can do your Bishop score before you agree to it or not. Now, not every care provider is going to be willing or open to doing the Bishop score. They might say something like, oh, the Bishop score doesn't matter and things of that nature. It might not matter to them, but it does matter to you. And like I said, that thing with like misinformation, you want to be careful with that because it is very important information for you to know. So it's your dilation, your effacement of the cervix, your station of the fetus, consistency of the cervix, and position of the cervix. A Bishop score of 8 or greater means that the chances of having a vaginal delivery are good, and the cervix is said to be favorable or ripe meaning like ready for induction. And a Bishop score of 6 or less equals the chances of having a C-section are high, up to 80%, and the cervix is said to be unfavorable, unripe, so not ready for induction. Alrighty, so I'm going to give you guys what the chart looks like. So there you'll see position, consistency, effacement, dilation, and station. You want to be over here. You want your cervix to be soft. You want it to at least be 60 to 70% efface. Efface means like thin. You want there to be some sort of dilation. At least 3 to 4 centimeters is great, but even 1 to 2 centimeters is better than it being completely closed. And station. You want baby to be fully engaged, so at a 0 station or -1 would be even better. So this is the Bishop score. And if you score 8 or less, so these are the points that you have at the top, like let's say your cervix is soft, you'll get 2 points. And then if it's 60 to 70%, that's 4 points. 3 to 4 centimeters, 6, and then 8. So if you're over here, ding, 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 ding. If they were to use certain medications like Pitocin, the odds of you having a vaginal delivery are higher because your cervix is already ready. It's already soft. It's already able to progress in labor. But if you're over here in the 0 points, your cervix is firm, it's not effaced, it's closed, your baby's up high, then if they were to put you in an induction, your body might not tolerate it well because there's just so much, it's just not ready. And that's when you can get a failed induction, which It's not really a good word to use, but that's the term that they use, and then they might want to usher you off to a C-section. So let's watch this video of what a C-section looks like. If you don't want to watch it, it's completely fine. You can skip through this video. Oh, this video is age 2. Okay, only available. So I'm going to put the link for this video so that you can watch it. And the reason why I want you to watch it is because a lot of the times people think C-section is just like this easy procedure, but I want you to see the reality of it. That way you can make an informed decision. Like, do I truly want to go through this procedure? Is this something that I am comfortable with? Do I trust people to do this procedure on me? It's easy to say yes to something when you don't really see the full picture. It's important to be informed, see the full picture. That way you can either feel confident saying yes or saying no. Also knowing the risks. So you guys can take a screenshot of this. There is 1 in 250 odds of uterine rupture, 1 in 769 infants mortality rate due to rupture, and 1 in 172 United States overall infant mortality rate. So this is basically for people who are wanting to have a VBAC. A lot of the times they'll say that a VBAC stands for vaginal birth after C-section. A lot of the times they'll say that they have a risk of uterine rupture. Uterine rupture is basically when the scar reopens during the pregnancy or during the labor. And they kind of scare moms and make them feel like you can't have a vaginal birth because if you were, that would happen. But the odds of that is actually 1 in 250. And they don't really emphasize that in a medical environment. So here's some stats for you guys that you can look at. Risk of hysterectomy is 1 in 238 for a second C-section. Risk of blood transfusion is 1 in 65. Risk of placenta accreta, 1 in 323. Risk of major complications, 1 in 23. Risk of dense adhesion, 1 in 5. And every single time a mother has a repeat C-section, the risks increase. The percentages of it happening become higher and higher and higher. And so the notion that having a repeat C-section is safer actually isn't the case. It's actually safer to have a vaginal birth than to have a C-section because there's less risks involved. Alrighty, placenta accreta. The reason why this slide is here because there are some moms who have this diagnosis, placenta accreta, and one of the things they say is they would have never consented or been so open to having a C-section birth if they knew about the risks of placenta accreta. Because if you get diagnosed with placenta accreta, your births after become very, very different because this is a life-threatening issue. So normally after birth, the placenta separates from the uterine wall, but with placenta accreta, it remains attached. And this is a common issue after multiple C-sections. And this can be found and diagnosed via ultrasound. However, ultrasound may not be the best in detecting accreta. Although it's the primary use, MRI can be used when an ultrasound image is difficult to interpret or to show how deeply the placenta has penetrated the uterine wall. Despite being diagnosed, some cases of accreta can be inaccurate. So there's different kinds of accreta. There's placenta accreta, and that's when the placenta attaches too deeply into the uterine wall. Placenta increta, when the placenta attaches in the uterine muscle. And placenta precreta, when the placenta goes completely through the uterine wall, sometimes invading nearby organs like the bladder. And this issue is common when someone has more than one C-section. So when you're thinking about whether or not you want to have a C-section or trying to avoid a C-section, also consider the risks and the diagnosis that could happen if you have a C-section, if you're pressured to have another C-section, if you're pressured to have another C-section. You know, C-sections are not just a simple surgery like they want it to seem like in a hospital environment. So now let's talk about VBAC. So for those of you guys who want to avoid having a repeat C-section, well, you want to know if you're a good candidate for a VBAC, because if they try to make you feel like you can't have a vaginal birth, you'll know, nope, that's not true. I'm a good candidate for a VBAC. I know that I can do this. So how to know the type of C-section scar. So low horizontal, transverse, this way, scar on the uterus is the safest. Vertical is more dangerous. Number of past C-sections. Ideally, you only want one previous section. Two is also can be considered a good candidate. But even if you've had more than two C-sections, you can still have a vaginal birth. It's just that there are more risks involved. The reason for the last C-section, if it was due to a one-time issue like breech, the chances of you having a vaginal birth are better. Healthy pregnancy, so no issues like high blood pressure, diabetes, or placenta previa. A natural labor start. So you went into labor naturally before. This also increases your chances for being a good candidate for a VBAC. You had a soft cervix before. So your cervix was soft and you actually were showing signs of dilating before you had a C-section. You've had previous vaginal births. You have support from your provider or your hospital. You have a strong interest in wanting to have a VBAC. You may be, I don't necessarily believe this, the younger age thing. I feel like that is not a real reason to be considered high risk. There are women who just get over 35 and all of a sudden are considered high risk. I believe that narrative is false, but there are some risks that are more associated with women at a higher age. But that doesn't mean that because you're at a higher age, you should automatically be considered high risk. But with that being said, if you're a younger age and you have a lower BMI, you're usually a better candidate for a VBAC. The baby's position is baby is head down, and you've had at least 18 to 24 months since the last C-section. Alrighty, so here are some common pitfalls for trial of labor. So a trial of labor after a C-section, often known as TOLAC, is basically when they allow you to at least try to go into labor, uh, which even that term I pretty much don't like just trying. It's either you're doing it or you're not. And kind of trying kind of sets you up for not succeeding by saying the word try, but that's another topic on its own. Alrighty, so these are the common pitfalls you want to look out for. False dilation readings. Sometimes, not all the times, but sometimes they can tell you that you're 5 centimeters when you're really 8 centimeters because they want to discourage you from having a vaginal birth. This has happened before. This is some real things. I'm not just making this up. These are things that have happened to women all around the world who've tried to have a vaginal birth after a C-section. Pay attention to these so that you don't get misled. Hospitals not keeping their promises about being VBAC friendly. Some hospitals will market themselves as VBAC friendly, but when you get there, they want to do continuous monitoring. They want to do quick timelines. They're not so supportive. They're still pushing for a C-section. And this can be very, very misleading. The lack of patience for your labor to start. So they might say, okay, yeah, of course, we can help you try to have the baby and and labor. And then as soon as you start laboring, you're not progressing the speed that they want you to progress. And then they say, oh, failure to progress. And then there's a C-section. And stalled labor. So if your labor slows down, they might want to do things like breaking the water, adding Pitocin, or adding these different medical interventions that can increase your risk of having more interventions, which will increase the likeliness of you having another C-section. Alrighty, so how to know when to head to the hospital when aiming for a VBAC. When you want to have a VBAC, the best way to do it is to go to the hospital towards the ending of your labor. So when full dilation signs mean you may feel intense pressure, you need to push or have a bowel movement. When the baby's head is low in the pelvis, you may feel strong downward pressure in your pelvis. Contractions may be 1 to 2 minutes apart and lasting up to 90 seconds. So this approach it's a lot of people think like, whoa, like what? Like waiting all the way to the end? Like what if you give birth in the car? Yes, there is a possibility that you can give birth in the car. You do want to time it so that you can prevent this from happening. But unfortunately, some hospitals are not VBAC friendly. And even if you arrive there at 8 centimeters dilated, they will still try to cut you open. And this is just so unfortunate. Some hospitals aren't. Some hospitals are very VBAC friendly. are very kind, are very supportive, and you'll go there and you'll be 8 centimeters and they'll say, awesome, let's keep pushing. You just got a few more to go and you'll have a vaginal birth. So with this scenario, keep in mind the hospital and your support team. If you feel like they're not that supportive, you definitely want to arrive when it's ready to push baby out. Alrighty, so that is the ending of our training. I hope you guys enjoyed learning about ways to help prevent or minimize the likeliness of you having a C-section. If you guys have questions, feel free to leave them down below.